Hi, welcome back to Chai with Chalk, and if you're new here, welcome! For today's video, we're going to be interviewing a PCP, also known as a primary care physician. If you've never heard of the term primary care physician, they're basically the doctors that you go to whenever you're sick or you want your yearly checkup. So hopefully we can learn a lot from this physician, and let's jump into the video! Hi, it's nice to meet you. I'm Sonika Chalk.
Hi, Dr. Budetti. Nice to meet you.
It's nice to meet you. So you're a PCP, right?
Yes.
Okay, so as a PCP, what do you normally do every day?
Well, I see multiple patients every day. I see about 16 patients a day, and I take care of 1100 patients on the whole. On a daily basis, I see people who come in for health maintenance visits, so there's nothing wrong with them. They don't have anything going on acutely, like no pain or anything, but they just come for the routine checkups just to make sure they're healthy and to get their yearly blood work. And then others come in for some medical issues like a cough, cold, or pain, headache, anything that might be wrong with them.
Okay, so do you see more like annual checkups or more like cough, headache kind of stuff?
I would say it's a 50-50% in my practice, but it really depends on what area you practice in.
Okay. So what inspired you to become a primary care physician?
So I always wanted to be a physician because I had seen my grandparents work as physicians, and I loved taking care of people. I also liked science, and I think medicine is an art. I consider myself more of a scientist and artist than a mathematician, and I'm a people's person, so I liked medicine. And then primary care mainly because it's a whole practice. You see the person as a whole, and it's a primary point of contact with medical care. So primary is the meaning of primary itself is either main or principal or the earliest in onset of any particular thing. So it is the first point of care for medical problems, and I like that. I find that challenging because when the patient comes in, I don't really know what's going on with them. I don't know whether he has a cardiac issue or a renal issue or a pulmonary issue. He comes to me first and just starts talking about everything that's going on with him. I find that challenging.
Oh, so that means, do you do a lot of like diagnoses?
Yes, I do. Yes, part of primary care is diagnosis. So history taking is one part, then physical exam, we examine the patient, and based on that we come up with a diagnosis and then plan for the patient. The plan includes testing, and the plan includes treatment plan.
Okay. So what kind of knowledge do you need to have in order to become like a PCP?
Every kind of physician needs the basic knowledge that is taught in medical school. There are basic medical sciences like anatomy, physiology, biochemistry, pharmacology, pathology, and microbiology. I think I've pretty much, and genetics. Now there's genetics.
Oh yeah.
So when I went to medical school, genetics wasn't, we did not know enough about genetics to have it as a subject, but now we do. So these basic medical sciences you have to have a knowledge of initially.
Okay.
And then in clinical practice you need a very good knowledge of a thorough physical exam and thorough history taking. And there is a subject called internal medicine, which touches upon all the systems of a human being, like central nervous system, cardiovascular system, pulmonary, gastroenterology, renal, endocrine, rheumatology. So you have to basically know about these organ systems that help us function normally in day-to-day life.
So you need to know like a lot of like anatomy-wise stuff?
Yes, you do. Yeah.
Oh, okay. So how many years of like schooling did you go through?
Oh boy, that's a count that I lost along the way. But I have 12 plus 5 plus 3 plus 4. So I think it's, let me see. I believe it's 18 to 20 years at least
Oh, like
of education, starting from kindergarten, of course.
Okay.
Yeah.
Okay. So in your job, like, environment, do you get to move a lot, or is it more of like a sit down kind of job?
So my job, unfortunately, right now is a sit-down kind of a job. I have to make it a point to move and get at least 100 steps between um, my two patients.
Right.
So once the patient leaves, I have to make it a point to move. My job does not require me to move right now. Yeah, but there can be a job where people are moving around. Usually, it's not in an office setting; it's in the hospital.
So you have more like an office setting job.
Yes.
Okay. So how many vacation days do you get in a year?
So right now I get 24 vacation days.
Yeah.
Yeah.
Do you think that's like a lot or not enough?
Well, vacation days are never enough, but I think that's I think that's a healthy amount of days off to take, because you have to balance your work with your vacation days. So for a doctor to take more than that off every year
Right.
would be like a lot of burden for that doctor when he or she comes back to work from vacation. So basically, when I go away for vacation, I have to take care of the work that I miss either before going or after coming back.
Oh, okay.
Yeah.
So it's kind of just like school.
It is kind of just like school. But in school, when you get some days off, your teacher is not teaching you.
Right, yeah.
Right?
Yeah.
But when I go away on a vacation, my patients still continue to have problems. They continue to get tests done, and the results are sitting in my mailbox. So when I come back, the work is, it's a lot of work.
So do you consider your job to be like stressful?
I do, yes. It's more stressful than I'd like it to be. But yes, I do consider it to be stressful.
Do you work like a typical like 9 to 5 style job?
Yes, right now I do. I did not start off working a 9 to 5 job because I used to admit patients in the hospital and I had to go do rounds in the hospital. But now I'm fortunate enough, I do have a regular 8 to 5 job. Yeah.
Okay. Since your job is stressful, like how do you manage your like stress?
So I think time management is the most important part, and also dissociating yourself, disengaging myself from the anger or emotion of a patient. That's I do empathize with my patients because that's part of my job. Unless I empathize with my patients, I won't be able to be a good doctor.
Right.
But I disengage myself when the patient gets angry or when the patient gets extremely emotional. There is a part where I have to sort of disengage and say that this is a part of the issue and I cannot let myself get entrapped in that negative emotion, otherwise it would pull me down. So that is one thing that I do. And with the workload stress, I like to prioritize it based on the urgency of the situation. So if say I get 50 test results back, then I can see which ones are high priority. Like if a patient had come in complaining of weight loss and I was worried about cancer in a particular patient, then I would go through that result first and prioritize it based on the urgency of the situation, and then try to go through the most important ones first.
Okay.
Yeah.
So, is there any work that you have to do like when you're not in your office?
Yes, I do have to check some messages from the patients, send them emails, and check their lab reports, their test reports when I'm not at work sometimes.
Oh. So are PCPs themselves like in charge of setting appointments, or is it more of like the front desk people?
Well, it will all depend on the practice setting. Some practices are owned by the PCP himself or herself. So if it's a physician-owned practice, each physician can decide how you want your patients to be scheduled. Every 15 minutes, every 20 minutes, every half hour, more time for new patients, more time for some patients with multiple medical problems, or just once you start practicing, that certain patients do need a longer time. Each time they come in, they have multiple issues. Then you can tell your front desk to schedule your appointments accordingly. But even if it's an employer setting where there is an administrative employer who is overseeing the practice, usually the PCP does get a say in how you want your patients scheduled.
Oh, okay. Okay. Thank you so much for your interview today.
Yeah, it was a pleasure.
Yeah, it was a
to
pleasure
you.
to meet you too. Well, I learned a lot from Dr. Merlaker, and I hope you guys did too. She talked a lot about what it's like to be a physician, and that's always something I've been curious about, like the lifestyle of someone who has a healthcare profession, because I've never been able to experience that myself, obviously. And I think the thing that I found the most interesting that she talked about was definitely when she talked about like work-life balance. I know a lot of like high schoolers can't relate to that because none of us work full-time jobs yet, but work-life balance, I feel like, is a really important skill that if you were to gain it now and then perfect it as you go on, by the time you're like working, it'll be a really useful skill that you'll have. Thanks for watching this week's video. If there's any specific type of doctor that you want to see interviewed, or if you have any questions that you'd like me to ask them, please leave it in the comments down below. Okay? Thank you. See you next week.